Does joint hypermobility mean a person is more or less likely to have osteoarthritis, especially hyperextended knees? And that's a fantastic question. I would say that hypermobility in and of itself does not correlate with arthritis, but instability does.
Right.
And so the question is how do we define hypermobility compared to instability? Beth, do you have any tools you would use to differentiate those two words?
Look, when you're hypermobile, most likely your ligaments have a little more laxicity to them. So there's a little more natural play. You don't have the support systems that typically maybe somebody else would have. So you got to use the muscular system around it, the perimeter, to become a little more like the ligaments to help hold that structure and learn where your body is in space to make adjustments too, so you don't hyperextend the knee. But it's very important that if somebody has a lot of laxicity, that they learn parameters to work within and then really build on a lot of strength to support the joint, especially the knee. It's extremely vulnerable. You have, it's the femur and the tibia, right? And you've got these wonderful ligaments. But if they have a lot of laxicity, then you got to create the support to the muscles around it to become a part of that support system even more so. And then that knee becomes more stable. And when somebody becomes aware where their knee is in space, even like when on footwork, where are they? Are they hanging on their ligaments in the back? Or are they able to recognize that and correct that? And again, hyperactivity is not an indicator for osteoarthritis. The instability of it and the lack of congruency is.
And I have a simple rule of thumb. You could have a lot of mobility or not a lot of mobility, but if you have control of it with congruence, then it's not a risk. If you have even limited mobility, but you don't have control of it, then it is unstable, has instability. So just a nice way of thinking of it is, I always give the example of the dancer that has incredible hip range of motion. They can take their foot behind their head, but if you ask them to do a passe développé, they can't lift their leg past 90 degrees. That's an instability. If you don't have control over that range, that's an accident waiting to happen. That's an instability. You don't have control of it. So when you talk about hyperextension in the knee, do you have control of that range? Can you moderate? Can you control it? And another way of looking at this, I love the literature, the book Physiology of Yoga, and I'll put his name into the study after because I have his book behind me. But he talks about the bandha, and that the bandha is a co-contraction around a joint complex. So even if we have hypermobility, think of yoga having a lot of hypermobility, but not necessarily instability. So we'll keep those two things separate.
The other thing is everything's got to be working together in unison. The whole house has got to be working. This is not one given area. And there's an awful lot of muscles that affect the hip and the knee and the foot. I mean, tremendous amount. And everybody's got to play together fairly, but it has to have a good, well-rounded program.